everybody. Welcome to today's session. So it is a very important session because I felt that now, as we all know, that the dates have been announced. So that is 9th and 10th September. So what I felt was that now you have a goal and you have the timeline for how you're going to prepare and what you're going to prepare. Now you have an opportunity to plan it properly, because for any such exam, so for any such exam, the most important thing is planning. So now you know that it is in September. Now you know that you have nearly 4 months, not completely 4 months, but now you have like 3 months and 27 days to be exact. So now, according to your preparation, according to the preparation till now, according to whatever you have studied till now, you need to decide, evaluate yourself, and then you need to go ahead. Till today, you were in that uncertainty regarding the dates, the timeline, how you should prepare, but now you have that goal. So now you need to assess yourself, first of all, what you have prepared till now. And then you need to decide regarding how you are going to prepare in this 3.5 months. Or to be exact, I would say that keep your timeline as 3 months. Keep the last 15 to 20 days for revision or as a buffer. That is what I would advise. Now, I will give tips not just for the students who are preparing for last 1 or 2 years. I would also give tips for the students who are preparing for their MS exam and also for NEET SS. So the most important thing is what I did was I divided this 3 months or the duration what you have into short goals, and not just 1 month. I divided into 6, or I would divide it into short goals of 15 days each. This is my, whatever I am sharing today is what I have experienced and how I prepared to crack the exam. So you can take ideas from my tips and then you can choose and decide your own. So the most important thing, as I told earlier, is planning. And then what I feel is that you need to give yourself one, that is short-term goals, and second, that is a long-term goal. So what would be a short-term goal for you? So if you say that you take a period of 15 days, so starting from today, if you take the next 15 days and you want to plan, so first of all, you need to decide. So now I would go into the detailed part. So we know that we have to study Bailey and we have to study Savston. These two books are the prime important thing what you need to do. This everybody knows that they need to read Bailey and Savston. But now you need to evaluate what you need to read from Savston. Bailey, you need to read completely. You need to read from first page to last page, except for some chapters like I and orthopedics, you can skip. Other than that, you need to cover Bailey from first chapter to last chapter. Savston, you need to read in a very smart manner. So first, if I would be preparing right now for the next 3 months, how would I prepare is I would decide, first of all, what are my strong topics and what are my weak topics. Now, strong and weak doesn't mean that you have not read. It also means that what you have already read, you are in that confidence that, oh yeah, I know this topic, but you need to go to the drawing board, see what you have read, what is your status regarding the retention, how much you are remembering, and then you can decide regarding how we are going to prepare, how we are going to subdivide. Now, to help you to subdivide, what we have done was in our modules, if anybody who is a subscriber who is listening, so we have divided into modules. So what we have done is, for example, we have divided modules into basic principles with the neurosurgery. So what we had done was that we divided into a topic from core general surgery and a topic of specialty. Now, how does it help is that if you have read some core general surgery topics, you may read it faster, you gain the confidence, and in that confidence, you go and read the specialty topic, which you may not have read. But because of that confidence, you will get that boost and you will be in that rhythm to read that specialty topic also. So this was one of the module. Second module was we took breast and we combined it with short topics like oncology, head and neck, oral cavity. So this is also another example which you can combine the two major topics. Breast, we have read during our MS. Also, we have read multiple times, and some part of head and neck oral cavity we may have missed. But because you are reading breast, you know, you have confidence, you'll be able to read this also properly. So during the planning, you need to subdivide your goals. So these are what I told as long-term goals. That, for example, if you're taking a period of 15 days, you need to give yourself long-term goal that I will complete either this chapter or I'll complete half of this chapter, but don't be in a haphazard that if I'm giving 15 days, I'll cover half of breast. No, you should give very specific goals to yourself. You need to read, and if you are reading for MS exam, what I have heard is that you have your MS exam in June, July. So you have nearly one and a half month to prepare for that. And the next 1.5 months you need to give for NEET assess. So now coming back to what I was telling regarding your short-term goal and long-term goal. So now, as I told that you divide your preparation in 15 days. In that 15 days, you gave yourself long-term goal that, okay, I will read the benign breast, I'll read head and neck, and I'll read oral cavity. Now you have that 15-day target. Now you have to subdivide that 15-day into short-term goals. That is, first 5 days I'll read this, second 5 days I'll read this, and third 5 day I'll read this and complete it. It is not necessary that you need to give yourself 200% above your capacity. You should give nearly 120% and then give your 150% to complete that 120% of your target. So if you do proper planning from long term 15 days, or if you can plan properly, if you have adequate time to plan properly, you can plan even for 1 month, and then you subdivide that into short term goals and further divide it into daily targets. You need to give yourself that, yes, I'll complete this topic, this 2 topics in 15 days. Then you need to give that, yes, in 5 days, I'll complete this. And then you need to give your target that today I'll finish this, tomorrow I'll finish this. So go to the drawing board, sit, prepare, and you can either go to our website and see how we have subdivided the modules, and then you can plan your schedule accordingly. If not, you can choose your own topics and then divide the schedule accordingly. Next, what I would advise you to do in this 3 months is minimum of 2 revisions if you can. Don't try and go for 3-4 revisions just for the sake of revisions. Even 2 revisions, if you have done very nicely, it is adequate. 3 times is a very good thing. If 2 times, that is ideal. So my advice is that you revise minimum of 2 times and maximum of 3 times if it is possible. So what you can do is first 1.5 months to nearly 45 days, you give for your complete concentration and reading. And next 45 days, you give for revision. You do not have to read the same way which you read in the first 45 days. Revision means revision. It does not means reading again. Revision means going through the most important things. So first is planning. Second is how you should divide between revision and primary reading. Third thing is regarding what you can read if you need to solve MCQs also. So in the previous session which we took, we had advice that you go for daily MCQ solving. Now what I would personally advise you is when you wake up in the morning, try and solve 150 questions minimum. You don't need to solve 2.5 hours like an exam. You can just read through swiftly through the MCQs. whatever platform you're using, MCQ practice, try to do minimum of 150 in the starting of the day. Your mind gets tuned to read according to the question and how we are going to answer. This 150 questions will set the rhythm for the day. Next, after solving that MCQs, go for the theory. That is what is important. This theory, you need to divide according to your personal preferences, how you are going to read. You don't need to ask everybody that how they are reading. You need to choose your personal preference and decide accordingly. Next, coming to after solving the questions, my advice is to solve in the morning. If you cannot, if you need to read, you can do it in the night, but try to solve minimum of 150 questions per day, every day. Now coming to what you are going to read in theory. So what I feel was, as I already told, that daily you need to read everything. Now the doubt what everybody has is regarding Saviston. What you need to read in Saviston? The basic surgical principles. You can skip the last 3 chapters, that is on geriatrics and the various studies and everything. You can just read the various tables given. Other than that, you can skip chapter 1. You need to read shock, wound healing, tissue regeneration. You can avoid from Saviston. You need to read regarding the diathermy and the electrical devices which are given. That is from basic surgical principles. Then if you go to perioperative anesthesia, you can read. You need to read the perioperative evaluation. Other than that, surgical complications. I think these 3 topics are important to be read from the topic of perioperative care. Other than that, other chapters you don't need to read. Next, you need to read trauma completely from Saviston. You need to read burns, abdominal wall, the difficult abdominal wall chapter. That is all what you need to read. Next, the topic of oncology, you can just read the neck notes, what is given. You may not read the detailed oral cavity cancer. That oral cavity cancer is enough from Bailey and Love. Malignant melanoma is important. You need to read. Basal cell carcinoma, SCC, you should read. The basics of oncology, just the various phases of oncogenesis, you can read from Bailey and just go through Saviston. Don't need to read in detail oncology. Next, you come to the endocrine. You need to read breast completely, thyroid completely, PTH completely, adrenal completely, endocrine pancreas completely. You need to read from Saviston. GIT must, GUT not important. You just can read Bailey. If you see the specialities, so in specialty, what is important to be read from Saviston? So you need to read the basics of neurosurgery. You do not need to go into detail regarding the various tumors and everything. Just read the basics. Infective etiologies from neurosurgery. You need to read pediatric surgery. You need to read the plastic surgery chapter. Basically, the flaps. Plastic surgery chapter is important. I agree. In hand surgery, you just need to read regarding the hand infections, and you need to read regarding the nerves. Nor vascular injury, tendon injury, bony injuries, fractures in the hand is not important. But what I feel is tendons, vascular and nerve injuries is very, very, very important. That's the reason why we have covered that in detail in our video lectures on YouTube. You can go through them, but you need to read that from Saviston because they have started asking questions from that. Next, if you come to CTVS, what I feel is that you need to read daily. That is more than enough from Saviston. In CTVS, what I feel is you can just read the named procedures. Saviston is very detailed. I don't think they will go into dashboard detail. You can just read the named procedures. So next, vascular, aorta, the basics classification and the indications of surgery that is required. Next, arterial, venous, lymphatic. Venous and lymphatic is must from Saviston. Arterial is okay. You can go through daily. That is more than enough. So this is regarding what you can read from Bailey and Savston. Now, coming to the students who have started preparing for their MS exam, and also those students who have taken break or have prepared for INECET, not prepared for general surgery, they're prepared for the specialty subject, now switching over to the NEET SS, how you can read and what you can read. So as I told already, you need to read Bailey. So for MS going students, Bailey is must. You can cover that, read that. If you have read Bailey and you have read Savston, even if you have read GIT, it is okay. Don't worry. Just read that. Make sure that what you are preparing for the exam, like for your MS exam, whatever you are preparing, even if it is the most important topics, you may not be reading other things, but even if you're reading just the important topics, make sure that after exams in the 1.5 months which is remaining, you may not need to read it again. Or if you need to read it again, it should be a very fast revision. That is what I would advise for the people who are preparing for the MS exam and also out down the line for NEET assessment. So basically what I said was till now was regarding how you should plan it. You have 3 months and 27 days. Plan it, your schedule. That last 15 days is dedicated to the weak areas regarding what you have read and you feel that you are forgetting. The most important thing in your NEET SS is not just your theoretical preparation, but also your retention of that reading. Because if you have read properly, you will easily be able to recollect things and you will be able to answer them. Because if you have read but you are not done adequate revision, you are not having retention, you will make silly mistakes. You may answer them correctly or incorrectly, but you have the increased incidence of silly mistakes, which is the killer of your all preparation. So to avoid silly mistakes, you need to do more revisions. So then, as I told, long term, short term, you divide your goals in the 3.5 months. Then divide the topics in the way that one topic you choose, which you have read, you are confident, the other thing which you are not so confident. So if you read them together, the one which you are already knowing, you get that rhythm confidence, and that will help you in reading the one which you have not read or it is a weak topic. But try to combine a topic from core general and a specialty. That is how I did. And that is also, I feel that it is more useful if you combine both of them and read simultaneously. So that while the time you cover the course, your core general surgery is covered, your specialty subjects are covered. And I think specialty subjects become the game changer in NEET SS because they have started increasing the number of questions which they are asking. So as I told regarding the planning, your study, what you are going to prepare, what subjects, how chapters you are going to divide. Third thing is remain stress-free. I have already written multiple blogs regarding your time management, regarding your anxiety management, regarding your increasing in the memory technique. You can go through that blogs. It will help you to decide how you want to make your preparation more efficient. The most important thing to remember is that even if you have read in the last 3 months or you're reading from the last 1 month, what is important is this 3 last months. That is the most important time which will decide how you are going to perform. Even if you're prepared for last 2 years, or even if you're prepared nicely for last 3 months, what is the difference? It will just make for a few questions which will be different. Other than that, almost there is no difference in your exam. So you now understand regarding how you want to plan and what you want to read. Now, some students ask me regarding how you can utilize us or how we can help you. So we have been regularly posting it regarding our various plans. So I'll just tell you in short, you can either use our MCQ bank, which I have subdivided into 12 modules, which I have again divided into, as I told, core general surgery with some specialty subject. So you can go by hand and read them and solve them. We have around 52 short tests, which covers each individual topic, and we have 10 grand tests, which we have combined, and we have made sure that you have more than 5,000 questions, which are ranging from easy to difficult. So you can utilize that. We have the notes which are included in a plan, which I have made sure that they are concise to the point, covering each and every line of Bailey and Savaston. So you can utilize either of them. And we have this package about the Bailey updates, which by this week end or by next week earlier, almost all the chapters of Bailey notes will be updated in the form of PDF. So those who have read 27, this package is important for you to just go through the update so that you don't need to read the whole Bailey again. And those who are reading 20th edition, you can see the deletions which are there in 27, which are also important. And last thing which we are having is the classes, which includes the table, charts, images, which adds to your preparation, because the theory which you read, questions are sometimes framed from the images, tables, and charts. So that is how we are covering each and every table, chart, images of Bailey and Savaston in our classes. So you can utilize our platform and our resources. If you are utilizing any other platform, try to remember the main important goal in this last 3.5 months is your planning and reading smartly, and revision is the most important thing. That is revision, revision, and revision is the most important goal, most important thing which will decide your result. So I think this is what I wanted to tell you, to encourage you to plan and read, start reading from tomorrow, to how you can give your 100% in it. Now I'll request anybody who has any queries or questions can ask. I think I have tried to cover whatever is important for you to get ready for this 3.5 months. If you have any queries, please let me know. I'll be happy to answer them. Anything you want to ask, please, you can write in the chat box. So I'll be happy to answer them. So yes, the notes, only GIT is pending, which will be available by next 10 to 15 days. So that in this month, already all the other notes have been uploaded. Exam pattern is, everybody knows, it is 150 minutes. You have 150 minutes, 150 questions, which includes everything from one-liners to clinical case-based scenario to image-based questions. So what sort of questions you can expect is, you can expect every type of question, which is either they will have a clinical case-based scenario with an image, or just an image, or a image-based question, or a one-liner, or all true except, or they would give a clinical case-based scenario. You have to need the diagnosis, and then they will be asking a statement which is false, or identify the true one. So the questions which are seen are one-liners, image-based, clinical scenarios, operative images, all to accept. So these are the multiple types of questions which are asked. So see, initially there is just last 1 year, which is having 150 questions. Before that, it was a 60-40 pattern. So in 150 questions, what I am expecting is that nearly, first of all, you will have 60 to 70 easy questions. You will have 30 to 35 questions, which will be moderate. And the last 15 questions would be very difficult. So this is what usually is seen, that 50 to 60% questions are nearly easy, so that it screens out the one who have read. Then comes the main important 50 questions, which decide the main ranking. And then comes the 15 questions, which decide the top rankings. So you can expect 60 to 70 of easy questions, 30 to 35 of moderate level, and 15 very difficult. And your goal is to not make any mistakes in this 60 to 70 questions, which are to the point and easy. So after reading theory, if you are finding it difficult to solve the MCQs, that means that you are not reading properly. That means that you are trying to mug up. Sometimes MCQ needs your logical thinking. It needs your power to eliminate the right and wrong answers and your ability to remember certain points. So when you're reading theory, don't try and read, like if you're reading for MS, yes, you need to read in the form, you need to rewrite the answers. But even when you're writing the answers, you need to remember the important points. And all the questions always are framed from the important points. Rarely seen that it will be from the rarest things. Yes, there are some instances when they will ask a very rare thing, but majority of the time it will be from the important points. So you need to read efficiently and smartly. You should not read line by line that, okay, this topic has this page and this has n number of lines. You read them and you try to mark them. No, when you're reading, try to go through line and mark the important things. Either you can write on the book in or in your notes, or you can make a post-it note and put it, so that when you're revising, you just go through that, so that all your important points are covered. So no, it is not 50 general and 100 specialty. Don't be in any kind of like doubt or anything. It is 150 PG exit level exam. It is not that specialty question means it will be from a specialty book. It means that there will be a question from the subspecialties, PG exit level. So it will be from Bailey and Sabiston, and Bailey and Sabiston both has the specialty subjects. So you can expect questions of that level. It will not be the way it was earlier, like 60-40 with 60 questions exclusively from the specialty, and it was beyond the PG exit level. Now the level will be low, but you can expect certain questions. And yes, other thing is also, this is a reason to make you practice all the types of questions. We are conducting weekly quizzes, which includes just 60 questions. We are organizing questions like NEET SS, including clinical case, the scenario, image based, one liners, everything. So try to solve them, try to attempt them as much as possible if you want. That will give you extra practice every week. Other than that, if you have any other doubt, please write in the chat box. I'll be happy to solve each and every one of them. Anything which you feel that I should address, please let me know. I have tried to address everything which is required for you to go ahead from tomorrow. If you have any other thing which you want to address, please let me know. So also, I just tell you that if you have any kind of doubt, queries, or anything, you can always reach out to me on my personal number, or you can email us. If you have any doubt, any queries, please feel free to contact me. So I think that is all what I want to say. If I think there is no more doubts from your end, then I will end the session now, and I'll wish all of you best of luck and all the best wishes. And remember, be confident and be smart in how you prepare for anything in life, be it any exam or anything, and give your 100%. That is more than enough to crack anything. So that is all, and I would conclude by that. So thank you all for joining, and thank you and all the best again.